Okay, behavioral health services.
Good morning, board. I saw this slide come up. I thought maybe Genevieve was going to do this for me, but I'll do my best. Todd, Metcalf, Behavioral Services. Good morning. So we have a few things to share, our accomplishments from 2022. We recently established a suicide review team. As some of you may or may not know, Lake County in the state of California has one of the highest, if not the highest, suicide rates. And so we made up a team. It's comprised of the sheriff, coroner's office staff, and invested and interested community members. The team is going to meet very soon. They will be meeting monthly to review deaths by suicide. And as I said, that they will be conducting their first review next month. And what the goal of this is that the team will identify existing systems level, what's working and what's not working. And so once we get some data together, we will be coming back and presenting to the Board of Supervisors the results of that. Excuse me. So we've also expanded narcotic treatment program services by being the first in the state to establish a contract and payment process with the first tribal 638 clinic provider for these narcotic treatment program services. You've heard me, we've presented to the board before around this. And this was done via contracting with New Life Clinic in Ukiah, so which the board recently approved, and we're excited that we have been able to expand those services. We are also one of a handful of pilot counties entering into a new electronic health record system. You've also heard me talk about this. It's slated to go live March 1, and we are very excited about this because it's going to help us improve our data and reporting outcomes. We've struggled with the system we've had for years. It's very clumsy and archaic, and we don't get, well, what's the old saying, garbage in, garbage out. We're not getting the information that we need, and we're also not able to capture billable services like we should. So we're very excited about this new system. This also will incorporate the California Advancing and Innovating Medi-Cal initiatives, which I'll talk a little bit about here shortly. Homeless outreach van. Sorry, I'm still going on about what we've done. We've had the van for a while, but we're excited that we finally got it. I hate to use the phrase tricked out. We've got one of those wrap things around it. I mean, it's got our logo on it. It's got the contact information. We have a regular schedule. We go around the lake. It's basically geared towards homeless outreach. And staff works with homeless individuals, providing access to resources and programs. We also hand out, toiletries, socks, snacks, whatever we can get our hands on. And our schedule can be found on our webpage. It shows where the van goes, and the community has been very excited about it. We are setting the stage for CalAIM initiatives and Care Court, which you've heard me talk about before. We had to submit an implementation plan to the state as far as how we are going to be able to roll out these initiatives. And so I'm not going to get into all of that. Care Court, we're going to talk more about that, not today. It's a big lift. It's a heavy lift, as is CalAIM. It's affecting a lot of other departments here in the county. Right now, I just learned that the County of Los Angeles is wanting to overturn the legislation recently passed around Care Court, and I will keep the board apprised of that. But the go live for Care Court in Lake County is July 2024, so we're working on that. We're actually having a meeting this Friday to sort of iron out whose roles and responsibilities and what we're supposed to do. So our points of emphasis, we, again, in response to CalAIM, but even before that we were working on this, we're working on streamlining access to our services. You may have heard of the no wrong door approach. It's sort of just pulling out all the stops and making sure that our folks have access to not only our programs and services, but other programs and services available in the county. We are working on finalizing our strategic plan. I just met with my team last Friday, and we've created sort of a skeletal plan. We're going to have it vetted by staff in the coming months, and I plan to bring that back to the board to share what our goals and objectives are. We retooled our purpose statement, and we came up with a vision statement. So we're very excited about that. Expansion of youth services, another CalAIM initiative that we are working on. It really will, the CalAIM initiative around that is going to sort of expand and relax eligibility requirements to get folks enrolled in Metcalf so they can receive the services that they need. Working with Supervisor Sabatier around the future of some kind of a permanent homeless shelter. You know, we recently were working with a contracted service provider to open a warming shelter at Old Juvenile Hall, but that's just not the answer. It's a temporary thing, and so hoping to bring something to the board. We really need to work on figuring out how we're going to solve this issue so that, you know, things are opening and things are closing. We need to figure out a permanent solution. So working on that. Collier Avenue, still hopeful that ground may be broken in March on a 40-unit complex, which will serve folks experiencing mental illness, developmental disabilities, and low income. So we're excited about that as well. And our Clear Lake Clinic remodel, we recently received a planning grant to start work on updating that building. For any of you that have been there, it's in dire need of a facelift. And so we're excited that we got funding for a planning grant to have someone come in and tell us what needs to be done so we can fix that place up. We're also developing a career path training curriculum. I'm proud to say our vacancy rate is fairly low right now, which is kind of unusual for a behavioral health services department. But we're working on developing recruitment tools, retention tools, and sort of turning our department into a behavioral health training ground. So people will come, we can train them up, and hopefully they'll stay. So it's a work in progress, but we're very excited about that. And peer support site and staff certification. We have multiple satellite offices. We call them peer support centers. And when I came to this department, I didn't quite understand what the term peer meant. We employ a lot of folks that have lived experiences, that have experienced or are experiencing mental illness, substance use disorder, and or homelessness. And so what this means is that we will be able to expand our services in our satellite offices. We will get our peer support staff trained up and certified so they can offer services on site that we can bill for, which would bring money into the department. So we're excited about that. And that, I think I've took too long. I apologize, but that's what we've been up to lately. And more to come.
Great. Questions from the board? Comments? Supervisor Crandall?
Yeah, so just one comment or recommendation on the Collier Avenue. Are there any initiatives to prepare for mental health services for on-site mental health patients once that commences? Are you working on that already, or is that something you have planned?
Oh, yes, there will be an office available Monday through Friday. It's what we call a supportive housing development. So there will be staff on site, and not only behavioral health services, and I don't want to speak for any other departments in the county, but our plan is we will have staff on site Monday through Friday, 8 to 5, for anything that folks there need. And we're hoping to get other community organizations involved in that. So
like the weekends could be.
There will be someone on site,
Yeah.
And there will be a property manager on site 24/7.
Will they be trained in like the mental health portion of
That's
it?
a good question, and hadn't really even thought about that. So
Okay. Thank
I'll
you.
work on that.
Yeah, just throwing it out.
No, that's a great question. Thank you.
Anyone else? Well, you know I always ask about the van, And I am just wondering if you have any statistics or success stories from outreach and connection to services, especially for those of us that have big unincorporated districts where the people are far from services. I'm just wondering if you have any of that to share.
I do, but I didn't bring it with me. I
Okay.
apologize for that. But and our hope is, as you may recall, we were able to purchase that van with cannabis funds, and we're sort of hoping that might come around again so we can get another one. So, but I will certainly come back and provide you with the data that you're asking for.
Thank you. Thank you.
Thank you.
So next we have Child Support Services.
Good morning, Board. Gail Woodworth from Child Support Services. So, as you can see by the slide, we've really been technology concentrating this last year. We've done a lot of upgrades to our system because we knew things were coming in the future. And so, along with updating our servers and all of our antivirus kind of things, trying to ensure that we have good mechanisms to keep our information in our system secure, we deployed high-speed scanners to each of the staff, and then that was done in anticipation of our e-filing. So that kind of goes into the next one, which we really we've been working on streamlining our legal processes. And this year was so exciting because we were able to go and start using the state's DocuSign system that works with our child support enforcement system. And then right behind that came e-filing with the courts. And I can say the courts put in a lot of time preparing for us to be able to upload our legal documents and then receive them back into our system. And this whole process it's not just days, it's weeks that those two processes have saved us. In fact, we had one case where a DocuSign went out to one parent, the other parent, and we uploaded it to be filed with the court in less than a half an hour. So when you have parents on board, with a court order, it can go really quickly. And so that we feel is really going to help our efficiencies as we collect child support. So our points of emphasis. So one of the things we continue to work on is opening more cases, and a lot of that has to do with outreach. And so, of course, with COVID, a lot of our outreach simply went away. So we're getting back into that and hope to be out there a lot more this year because people need to know what we can do for them. And people tend to think we're child protective services, and we're not. We're child support services. We establish paternity, child support, and medical support, and then enforce those orders. So the state looked to some of the small counties and saw that we weren't utilizing Facebook and those kind of things. And so the state actually took over and has implemented Facebook, and then we'll be doing Twitter and Instagram, which I know nothing about Twitter and Instagram, so I was happy that they have people on staff. And with our input, they're going to be doing those things for us. And of course, we continue to work on staff development. I think cross-training is vital for the growth of staff and for succession training. The state now has what's called Blackboard, and it has over 270 trainings are available. And then we also use Skillport at LinkedIn, and we have our in-house training. So it keeps us busy.
Thank you. Anything from the board? Okay, thank you so much.
Thank you.